Just give us your best guess on where it's being picked up.
That will be in the data that we're looking at. We know that there are really significant workplaces where transmission's occurring, the ones that we've listed previously, and they really are those essential sectors. So aged care, healthcare settings, meat works, large warehouse and distribution centres, food production, food distribution. That's where we're seeing numbers for sure. But of course there's a concern that there are other workplaces where maybe they're not so visible because they don't lead to explosive numbers of cases. We don't see outbreaks manifesting, or maybe they've got a very young workforce, mostly with mild illness, contributing to transmission but not necessarily showing up in the numbers or showing up in hospital because they're not as at risk of severe disease. So that's part of the deep dive that we're going to do, that we've always been doing, but that we're really looking into now, today and tomorrow. Clearly there's a concern that there's a broader cross-section of workplaces, transmission between workplaces and home and back again, that's contributing to the significant numbers. I should say, it's dispiriting to see big numbers, and we all rise and fall with the numbers every day. The stage 3 restrictions had a really significant impact, and people should be gratified by the fact that that's the case. The effective reproduction number was probably, at 1.75 or close to 2. It's come down to 1. But as the Premier said, we can't sit with 400, 500, 600 cases a day ongoing. We have to drive it down even further. And so that's part of the deep dive into the data to understand.
So what's stopping you preempting? Because you didn't wait for a lot of data in other times. So why wait for the data this time?
Well, we've always looked at the data on a daily basis. We've seen modelling that suggested that we might tip over and have numbers reduce. But every day that we see numbers, every day that we see different settings and transmission occurring leads to a re-evaluation of how that's going. And obviously, when different cohorts of the population are affected, or it's spilling out into a different age group, a different geographical area, a different subsection of the population, that drives a different transmission. And so we have to review time and again. We've obviously had a number of interventions that have been very successful with the stage 3 restrictions. We've had other interventions that have come into play just in the last 2 weeks, including universal mask use, which has been modelled to have a really significant impact. That may or may not be playing out now. We've got increased workplace compliance. We've got increased oversight of cases and their close contacts. So all of those are new interventions that will show up in the data, but they're not necessarily there yet for today.
So for we laymen, can you explain over the next couple of days what will actually happen? A whole lot of people in one room, or just so give us paint a picture of what is actually going to be happening and who's going to be involved?
Yeah. It won't be a whole lot of people in one room. It'll be a whole lot of people on Microsoft Teams or Zoom or whatever, talking through those numbers. The detailed analysis really relates to who, where, how, why, and that's the age groups, the occupational groups, other demographic data in terms of country of origin or language spoken to understand where the transmission is concentrated, and to really explore those hypotheses of where transmission's occurring and what needs to happen in order to really suppress that transmission. And we've obviously had a lot of focus on those high-risk areas, and I'm sure that that's made a difference in those areas. But there's two questions. One is it enough? And two, are there other settings that we really need to explore in terms of making sure that people aren't in those workplaces infectious, or in those workplaces as close contacts, or potentially infectious developing illness.
Right, yesterday there were 500 or just over 500 healthcare workers affected, and today there's 1,030. Where are those healthcare workers, and is there enough protections for them?
I think I've said before, Andrew Wilson in Safe Care Victoria, our Chief Medical Officer, is looking into the healthcare worker infections. That work will probably be complete this week. We know it's a mix of aged care workforce, doctors and nurses in our acute care settings, but also many of the other ancillary workers in acute care. it's a huge concern to see healthcare workers developing illness. It is not always straightforward to understand how they've acquired their illness. We have to be open to the fact that personal protective equipment may or may not work in certain circumstances. It's been provided to everyone, but there's always a review of is it sufficient? Is it being used properly? Is it being used in all settings, in all circumstances where transmission might be occurring? I'm certainly not jumping to a conclusion that healthcare workers are only getting it outside of their workplace. That is not the case. Transmission is a risk within workplaces, but we do need to dig down to it to understand exactly how that's happening.
Last week you said there's no evidence that a stage 4 or a New Zealand style lockdown would work here. Do you still feel that way?
I think that's what we're exploring now. Obviously, a step up in restrictions is a really significant measure, but we are wanting it to be informed by evidence to the fullest extent possible. It gets to that point of being proportionate. There are, really significant consequences for what you do in terms of increased restrictions, and so it has to be focused on what the data tells us about where transmission might be occurring. It may be the case that an intervention in a certain area will make a difference. It may also be the case that we, look at restrictions in an area that are not a driver of transmission, and that would be an unfortunate impost and unfortunate consequences for everyone who might be involved there. So that's really what looking at the evidence, looking at the data is focused on.
How much consideration of the impact, talk about proportionality, how much an impact on, say, businesses' employment would be made as part of those considerations in a further lockdown?
Yeah, it's absolutely, the impact on businesses, the impact on people's livelihoods, on their psychological and emotional well-being are all part of those considerations. And I've said before, these are impossible decisions in lots of ways. We are balancing harms, the harms of what increased cases over time would be and the unfolding aged care tragedy that we've got right now, and all of the other consequences that happen when you've got increased restrictions. So it's a balancing. We absolutely have to get these cases down, because if we don't do that, there will be ongoing consequences for everyone into the future. But we're totally mindful of those broader impacts.
Rich, I might just add to that if I can.
Every day we find X number are still under investigation. Do you have a percentage of the investigations where you still don't know? You can't do contact tracing, you can't figure it out. Is there a percentage of that?
So for the numbers that are under investigation, a majority of those have been interviewed. They've provided their close contact details. We haven't necessarily tied them off completely because there might still be a tentative link that's being explored to an existing cluster or outbreak or known case. So the numbers under investigation doesn't mean they haven't been contacted. The numbers that are contacted on a daily basis are essentially the cases that we're getting notified to us if someone's responding to that call, which is the great majority. So they are almost all covered on a daily basis, but the under investigation will keep that status until they're totally tied off.
So I suppose what I'm asking is referring to what the Premier mentioned before, the mystery ones. Is there a large percentage where you really just don't know how it happened?
They're not a large percentage, but they're not insignificant. I have got the number for today. It's an increase of 94 since yesterday that have been determined as community transmission. So where the source is not necessarily known, that has grown over recent days. So that's still a minority of our total daily cases, with the majority being known close contacts, known outbreaks and clusters. But the community transmission cases are a concern, and they are the ones that are addressed through the physical distancing, the restrictions that we've got with stage 3 and any other restrictions that would be put into place, because obviously it works for all of us across the population, regardless of whether we're known to be a close contact or not.
Brett, just on contact tracing, how many people a day at the moment are we managing to interview and determine their contacts? What's the average time it's taking to do that?
My understanding is that all notifications that are coming in every day are allocated for interview that same day, and those interviews are made or attempted to be made multiple times for every single case.
On that same day?
On that same day. So for the cases that are coming in through the previous day and into the night and overnight, they are allocated from early the next morning to be interviewed. There are those individuals who aren't picking up the phone or who have no contact. Hello. I'm still here. But the door knocks are part of the capturing everyone who might not be contactable by phone if we've got other contact details to be made.
How frustrating is it for you that you had modelling that showed we could have reached our peak on Monday and then we've just seen these cases go so far?
We're all rolling with the punches. No one likes numbers to be increasing. Everyone's hoping that the additional interventions that we've made all along the way will be kicking in, day out. To see it not turn the corner is absolutely a cause of frustration, not least because it's not just a number. These are people's lives, and we know what the consequences are and how tragic that is. So it's awful. It's awful to see. It is somewhat gratifying to see the kind of modelling that shows that masks make a difference. It's also very gratifying to see that, it must be more than 95% of people are wearing masks all of the time. What we can't necessarily be assured of is it happening for the population that we most need to reach, in those postcodes that we most need to reach, and at all times. Wearing it outside on your own, great, but not a significant driver of transmission. But in the workplace, when you're having your breaks with your workmates, is that distance being kept? Is everyone keeping their mask on all of the time? They're things that are not easy to understand, but it's certainly gratifying to see that the vast majority of people are wearing masks all of the time.
Brett, so how masks have been working, even though we've seen numbers go up in transmission in workplaces?
Oh, yeah, I think it's fantastic that masks have been adopted as a kind of new cultural norm across the board, and now we're seeing it across Victoria. I think people understand that it's a small intervention to make. There might be people who feel that they've got a constraint on their liberty and need to protest it. I would rather see them stand there naked with a mask on than not have a mask. We know that masks are a really important intervention for this virus that, let's face it, can kill the person that you're in front of.
My last question is just, last week you said that a New Zealand style lockdown could do more harm than good. Is that something that you still think in Melbourne?
Oh, so we're looking at what additional, interventions might be. My point about New Zealand is that New Zealand went through a process of a very hard lockdown across multiple industries at a point where they had very little community transmission and much smaller numbers. It was a different circumstance at a different time where those interventions would have acted on transmission differently. We need to look at what our circumstances are in Victoria now, with a lot more community transmission, bigger numbers, and different populations affected in different areas. So we need to just see where we focus our attention on any additional restrictions or interventions.
Brett, the management at St Basil's says that in exchanges with you, it warned that removing the workforce there wouldn't be beneficial to the residents. Is that your recollection of the exchange, and do you regret removing the workforce?
No, not at all. I wrote to St Basil's to say that we had to consider their entire workforce as close contacts, because what have we got to? 124 cases in St Basil's, and that's with the intervention. Without that intervention, with additional staff who were going to become positive over coming days, as they were, that's just more and more residents exposed and infected and dying. So I have absolutely no regrets about writing to St Basil's to say that they needed to change that workforce. What I did say is they should do so when an appropriate workforce can be mobilised. There was also reasonable excuse not to follow those directions. If they felt like there was an impossible situation where they couldn't get a reasonable workforce to transition, I would have been very happy to have that conversation. I wasn't involved operationally on the ground, so I haven't been involved in how that transition was made, but the recommendation was based on protecting those residents from staff who were already infectious or about to become infectious.
What data items do we collect when people are getting tested and when we're contact tracing? Things like, are they asymptomatic when they test positive? And why aren't we making more of that data publicly available and published?
We collect a lot of information about when someone's become symptomatic, where they've been in the 48 hours before they were symptomatic, because that's regarded as a potentially infectious period, all of their close contacts, all of their demographic details. That's part of what we use for our internal analysis. In terms of what we make available, I'm not one to hang on to information that might be of use to the general community. I think there's been a request for a more localised postcode data. I'm supportive of that, as long as it doesn't identify individuals or potentially identify individuals with a notifiable disease, because that protection of privacy and the knowledge that people can come forward for testing, get a positive result, and not be afraid that their information will become publicly available is a really important measure as well.
Brett, with all the restrictions in place, it still seems to be, as the Premier highlighted, a quarter of people aren't doing the right thing when they're positive, not the rest of the community. Is it time for something in that space to be done? Because otherwise all other restrictions seem pointless if people who have this virus are going out and disadvantaged.
Yeah, I think in terms of being really clear that positive people need to be absolutely isolated, that's what we're working on right now. That's what the ADF are doing. I'm actually aware that they're going out multiple times a day. There have been people who've not been home twice in a day. That's not exercise. That's clearly being elsewhere. And I think that the penalties that are available, having been referred to police now, will shift those behaviours.
Should that exercise right be removed for 2 weeks while they're in isolation?
No, I don't think so. I think the following the directions on isolation will be absolutely sufficient to protect others. You just need to do the right thing, which is staying at home.
Take all doubt out of it just for that 2 weeks.
No, I think the issue that we're facing at the moment is that there are people who are going to work infectious, that there are people who are seeing others in close contact whilst infectious. That's where transmission occurs.
Can I just ask about the postcode data? You've said a few times you're totally okay with it being out. It's not.
We're working on it now. So there's, we've got a Power BI platform that can incorporate that. We need to work with the technical fixes that allows that to come through. But there's some ambivalence about people saying, "Oh, I need to know that it's in that postcode and not my postcode." So maybe I can behave in a way that doesn't recognise that this virus is across Victoria. It is across Victoria. I don't want people to have a false sense of confidence about not following all of the directions that are in place because they're in a big shire and they say, "Oh no, the cases are in that postcode over there. Maybe I can go and see my mates." I don't want that to happen, but I do think that the transparency about all of the cases across Victoria is reasonable, and I think it's it's a sign of confidence in the Victorian community that they can look at those numbers and that they can act accordingly, including following all of the directions that we have in place.
Taking that risk of complacency into consideration, and we know that obviously these last few days these numbers have been really depressing for the public to hear. Generally speaking, we know that the higher numbers, high proportions are coming from those more vulnerable workplaces. In terms of the general community, how are we tracking?
Oh, so outside of those hotspot areas, we have seen an increase in cases, so there certainly is no need, or I wouldn't want to see any complacency for anyone, even if the risk is lower, because it only takes that single case, and if you're behaving in a way that says, there's only a 1 in 10,000 chance of me running into someone else, that is where it all started. We started in this state with one case, and it grows over time if anyone thinks that they're not personally at risk either of contracting it or passing it on to someone else. So everyone needs to have a laser-like focus on the fact that it's a collective responsibility wherever we are, whatever postcode, whatever cohort or group in the population.
Did the AHPPC recommend tougher restrictions in yesterday's meeting?
I wasn't on yesterday's meeting for AHPPC, but we always have conversations. AHPPC isn't there to recommend anything to Victoria. That's for Victoria to determine. We've got access to all of our very detailed data, but I would always welcome, and I do, the exchange with AHPPC with all of the expertise they have about things to consider. But it is for Victoria with the detailed understanding of our epidemiology about what we need to do for this state.
Brett, what concerns did you have about resourcing for the public health unit and contact tracing before the pandemic? And do you think we can play catch up on scaling up as a result of it?
I've said before, my focus is unequivocally on how to respond to this pandemic. I'm not in the business of providing commentary about historical matters.
Well, just unless